So cherubism is actually, you can remember it by acute lesion. What happens? The children look very cute because their cheeks look very chubby. You can see here. Now this chubbiness comes from the expansion of jaws. Their jaws expand in a bilaterally and symmetrical fashion. Previously in fibrous dysplasia's classification we saw cherubism. So it is called a familial fibrous dysplasia of jaws. Why familial? Because it is inherited in an autosomal dominant manner. Now this swelling of face, it leads to a typical facial expression. We have words to describe this facial expression, that is angelic or cherub-like. Now cherub is a word that is derived from basically biblical paintings and like Christian drawings. Cherubism occurs due to a mutation in gene, and this gene is called SH3PB32. A mutation in this gene causes cherubism. Due to overexpression of this gene, two things happen. The bone genesis is increased and the osteoclastic activity is also increased. Now osteoclast does bone resorption and bone genesis means formation of bone. So both of these activity are occurring together, which leads to the growth of bone but in a cyst-like manner, and this leads to cherubism. Now clinical features. It usually starts from 14 months or 3 years, and it grows until 5 years of age. Around puberty or usually 14 years of age, it usually regresses on its own and the child starts looking normal. It has a male predilection. Now sight, there is a bilateral expansion in both maxilla and mandible. Bilateral as in both sides of the maxilla and mandible will start expanding. Clinical presentation. So the swelling here is asymptomatic, painless and firm on palpation. So when we will touch the cheeks of the child, it will be firm and we will feel a bony presence inside the swelling. The characteristics are eyes to heaven. Eyes to heaven means you can see a rim of sclera. Sclera is the white part of the eye. This is the white part of the eye, and this is visible like a rim, and the eyes appear to be looking towards the heaven. This happens because the maxilla is expanding and it is pushing the eyeballs further upwards, causing the sclera to be exposed. Next is cherubic face. This is the cherub that we talked about. Now full moon face. Full moon face is because of the lymphadenopathy. Lymphadenopathy is the enlargement of lymph nodes. Because the cheeks are also looking expanded and there is lymphadenopathy which also makes the face look fuller, that's why it is called a full moon face. Other systemic problems that we see is cervical lymphadenopathy, respiratory obstruction, and there is impairment of vision and hearing. All of this occurs because of the maxillary expansion. Now the maxilla has expanded so much that it has now led to respiratory problems and problems in vision. Next are the oral manifestations. So there is a narrowing of maxillary alveolar ridges. The maxillary ridges, they turn slightly V-shaped. The dental anomalies that we see is first is missing teeth, and the most common missing teeth are second and third molars. There is delayed eruption and there is premature loss of deciduous teeth. The disease is self-limiting, as we saw that it stops growing after the age of 14 years. And the patient is clinically normal by third decade of his life due to the continuous remodeling of bone. The bone continuously undergoes resorption and deposition, and the bone and the facial structure regain their normal structure. Why all this is happening, that we will understand when we study the radiographic. There are some syndromes associated. We just have to remember the name. That is the Noonan syndrome, the Remens syndrome, and there is type 1 neurofibromatosis. Features. We can see radiolucency and it is bilateral, that is happening on both sides. It is symmetrical. So there is enlargement or bulging of the jaws on both sides in a symmetrical fashion. And it is multilocular. You can appreciate it here that there are multiple locules of radiolucency. In the early lesion, the radiolucency occur in the posterior part of the mandible. And advanced lesion causes displacement of inferior alveolar canal. We know that the inferior alveolar canals runs along the lower border of the mandible, and due to the continuous expansion of the jaws, this canal is shifted further downwards. In maxilla, we find absence of tooth follicles. This explains why we learned that there is missing teeth associated. We can also see a hard palate sign. The hard palate sign means there is a prominence of posterior part of hard palate. The dental findings that we see is absence of teeth, we just learned. There is alveolar bone destruction, because obviously we just saw that the bone is getting destroyed. And the important thing is floating tooth syndrome. This happens because the child is still at a young age, that is 3 years, 5 years or 14 years, and still there are a lot of unerupted teeth. The unerupted teeth along with the destroyed bone. So the teeth appears to be floating in this space. You can appreciate there is loss of bone here, and there are multiple unerupted teeth which seem to be just floating. You can relate it with the delayed eruption that we studied. Delayed eruption is happening because there is no bone to guide the tooth into the oral cavity. That's why there is a delayed eruption. Histopathology. So first, it is an unencapsulated lesion. That means the lesion is free to expand. It is not surrounded or closed by a capsule. It has thick eosinophilic perivascular cuffing. What it means is the blood vessels, around the blood vessel there is cuffing of eosinophils. That means there is a lot of eosinophils surrounding the blood vessels. That's why it is called a perivascular cuffing. We can also see multinucleated giant cells. You can appreciate it in the H&E stain. There are multiple multinucleated giant cells. Then there are numerous spindle-shaped fibroblasts. These are the numerous spindle-shaped fibroblasts. The connective tissue is also highly vascular. That means there are a lot of capillaries present. And because there are a lot of capillaries present, they sometimes break down. Due to the breakdown, they deposit some hemosiderin into the tissues. Hemosiderin is a breakdown product of blood. The differential diagnosis is giant cell granuloma or aneurysmal bone cyst. For treatment, we do cosmetic surgeries. Although this lesion is self-limiting and it regresses by the age of 14 years, and by the third decade the patient is completely normal, but if there are some residual anomalies, then we correct it by cosmetic surgeries.